Throughout the School of Medicine, physicians, scientists, and students are transforming the trajectory of medicine every day. In the hospital and clinical practices, in the community, the classroom, and the laboratory, their accomplishments are many. They've discovered diseases and developed new drugs, created new surgical devices and life-saving treatments, helping people throughout Maryland and around the world. Research activity at the School of Medicine is expanding under the Special Transdisciplinary Recruitment Award Program, or STRAP. Tracy Bale will lead a new Center for Brain Development and Maternal Mental Health.
Through our research, we can interact then with many different investigators studying things such as autism, schizophrenia, ADHD. There's a large number of investigators here at Maryland that are interested in maternal diabetes, and that's a great example of an opportunity to bring together basic and clinical science.
STRAP is already expanding our ability to make breakthrough discoveries and find new treatments for serious diseases. 10 teams of well-funded senior scientists have been recruited under the STRAP initiative, the most significant and ambitious recruitment effort in our history. With the increase in research activity, it's a good thing Health Sciences Facility 3 will soon open its doors. With 430,000 square feet, HSF3 will house well-funded investigators working to answer big science research questions. Investigators will have access to state-of-the-art labs and collaborative spaces to foster multidisciplinary research. Collaborative program tenants will include the Institute for Genome Sciences and the Program in Personalized and Genomic Medicine. Collaborative research abounds in the Department of Psychiatry. Under the leadership of Dr. Bancole Johnson, the Brain Science Research Consortium Unit is conducting studies on sleep disorders and sex differences in brain function. The Maryland Psychiatric Research Center, now in its 40th year, is conducting basic and translational research into the causes and treatment of schizophrenia. Collaborative research is also being carried out through Empower initiatives between the University of Maryland, Baltimore and the University of Maryland, College Park. At the new Center for Sports Medicine, Health and Human Performance, the School of Medicine's program in sports medicine will improve treatment, education, and research in the care of athletic injuries.
The initial research focus for this facility is going to be on mild traumatic brain injury, which represents, as many people in this room know, a tremendous threat to our athletes at all levels.
There are almost 4 million head injuries a year in the United States. 3/4 to 80% of those are mild traumatic head injuries or concussions.
Another powerful partnership is the one forged between the School of Medicine and the University of Maryland Medical System, paving the way for faculty to provide cutting-edge care at an ever-growing number of locations across the state.
We're very grateful to Dean Reece, to the clinical chiefs and the faculty for everything you do every day. Your intellectual capital, as well as all of the hard work you provide, really make us a much stronger and more capable organization. We've grown now to be 14 hospitals spanning the state with over $4.5 billion of revenue. And we'll start construction of a new regional medical center in November, and that power of partnership will be very alive and well in Prince George's County. So very grateful, very thankful to Dr. Reece, the whole medical school, faculty and chiefs for everything you do every day to make our joint partnership stronger. So thank you.
The economic impact of University of Maryland Medicine is estimated to be $15 billion. The human impact is priceless.
When you think about the unique mission of the Academic Medical Center, ours is a noble mission that differentiates us from 44 other hospitals in this state. So we are committed to delivering the highest quality patient care. We are equally committed to educating the future healthcare workforce, while we are also driving innovation.
At Waterloo Crossing, a multi-specialty 35,000 square foot comprehensive outpatient facility.
Is that good height?
Yep.
The Department of Ophthalmology and Visual Sciences is providing advanced eye care to more patients than ever before. Under the leadership of Dr. Benny Jang, research is expanding and clinical activity has increased 100%.
We've been working with the community docs instead of against them. We've been engaging them in our program, working with them, sharing patients, and I think that has really helped us with our success in building our program and doubling the size essentially in the last few years.
In a first-of-its-kind clinical study, adult stem cells were injected directly into Shania's heart to treat a congenital defect.
Our premise is that the stem cells will regenerate or remodel the heart. In doing so, the heart will pump blood more efficiently through the body. So that will make these little babies have better surgical outcomes and live longer.
In the Department of Neurology, clinical research is providing new hope for epilepsy patients who don't respond well to medication. With new diagnostic scans, abnormal brain cells can be identified and removed to treat seizures.
The statistics are that in a well-localized person, that's to say someone we definitively know where the seizures are coming from, patients can expect a 70 to 80% chance of cure. So it's a dramatic result compared with just using additional medicines where the likelihood of cure may be less than 5%.
In the Department of Surgery, pancreas transplants have increased dramatically, curing more patients of insulin-dependent diabetes.
Because pancreases tend to come from very healthy donors, and because the kidney comes from the same donor, when I help somebody with a pancreas transplant, I can also offer them a very high-quality kidney. And so many times we are adding decades of life to these very, very sick recipients.
Promising new clinical research is also underway in the Department of Neurosurgery, where Dr. Graham Woodworth is treating people with deadly brain cancers.
I had severe headaches, nausea, and then the final thing that really, I knew something else was wrong was my vision. I started having double vision.
Dr. Woodworth's team is using ultrasound to target the cancer and then delivering anti-tumor drugs through the blood-brain barrier directly to the cancer.
If I hadn't been fortunate enough to be referred to him, I don't think it would have turned out the same way. So thank you for saving my life.
With a presence in 35 countries, the School of Medicine's clinical care and research has a global impact. The Institute of Human Virology, celebrating its 20th anniversary under the leadership of Dr. Robert Gallo, is fighting AIDS in Africa. With a $138 million federal grant, the IHV is coordinating with African nations on a global response to the pandemic, while continuing to work on a vaccine to block HIV infection. In 2017, a cholera vaccine invented by Dr. Myron Levine and Dr. Jim Caper of the Center for Vaccine Development was recommended for use by the CDC to U.S. adults traveling to areas with cholera. As a School of Medicine faculty member himself, UMB President Dr. Jay Perman is proud of what faculty members have accomplished.
I see faculty colleagues who truly are extraordinary. I've worked in a lot of places. Those places ain't got nothing on us. Ain't got nothing on us clinically. That's how wonderful I think the clinicians on our faculty perform. I've also been in the research laboratories, in the clinical departments, and in the basic science departments. It's in those laboratories, and it's in our clinical research at the bedside and in the community that give credence to what I say when I say we are going to improve the human condition.
The increase in clinical and research activity by faculty is reflected in a record-setting total for grants and contracts. The total income from grants and contracts rose dramatically in FY17 to peak at $447 million, representing a 21% increase over the past 5 years. Driving the increase was a surge in grant applications and new awards, and $30 million in additional funding brought in by scientists under the STRAP initiative. Under the leadership of Senior Associate Dean Dr. Tony Lehman and Associate Dean Bill Tucker, clinical revenue has grown 22% in the last 5 years to $315 million. Research productivity remains high. The mean funding per principal investigator is $410,000, placing the School of Medicine in the 85th percentile of all medical schools. Looking at AAMC funding data, the School of Medicine ranks 8th among all public medical schools nationwide.
At Nanoburnetics, we're really excited to be in the Maryland-Baltimore area.
On the education front, the LIGHTBULB Moment competition is giving student entrepreneurs a chance to share product ideas that could one day save lives.
We're developing a molecular diagnostic to help clinicians accurately assess remission status in leukemia patients.
Like the TV program Shark Tank, finalists went before a panel of judges, including doctors, researchers, and investors.
Neurology at University of Maryland.
It was another successful match day and graduation, with 39 graduates securing residency spots in Maryland. In the most competitive match in history, our graduates placed very well, finding spots in 68 different hospitals in 24 states.
These past 4 years, I didn't just learn medicine, but the faculty especially really taught me how to be a doctor and how to care for patients.
Our educational excellence has been thoroughly documented this year under an arduous review by the LCME, the accrediting body for educational programs at schools of medicine nationwide.
3, 2, 1.
Students and faculty alike are thankful for the newly renovated Leadership Hall in the medical school teaching facility.
The sight lines were impaired, so we actually raised the stage a few inches to help with the visibility.
The Office of Development led the grassroots funding drive to help pay for the renovation.
It was frankly met with great enthusiasm from the chairs, the directors, and even our Board of Visitors, the leadership of the School of Medicine, and who contributed the majority of the leadership gifts.
The Office of Development is also partnering with the Medical Alumni Association to raise money to renovate Davidge Hall. In 2017, the School of Medicine received $52 million from generous donors. The university's Catalyst Capital campaign will take us to an even higher level. External support is vital, since state support is but a fraction of the operating budget. Under the watchful eye of Senior Associate Dean Louisa Peartree, the budget now exceeds $1 billion for the first time in history.
We're just going to have a conversation.
Community engagement remains strong, with educational and clinical outreach to our West Baltimore neighbors. Residents are learning how to improve their health through Mini Med School, now in its 16th year. Children at James McHenry Elementary are benefiting from the Medical Neighborhood Program. The goal is to dramatically improve the health of West Side residents through a high-quality, integrated delivery system that reduces costs and enhances the patient experience.
Carrots, broccoli, potatoes, yummy.
Healthy eating and exercise is being promoted in schools through a $5 million grant to study childhood obesity.
These wellness champions that we will train will work with wellness teams in schools to implement the policy and create a health-promoting school environment.
From research and clinical care to education and community engagement, 2017 has been a banner year for the School of Medicine.
I think we've become an exceptional medical school, and I think connected with a real sense of humanity. And I think that compassion is expressed both in the quality of care that we provide locally in our country and around the world.
The University of Maryland School of Medicine, transforming the trajectory of medicine.